question I feel
Mhm.
like is a little more complicated.
Okay.
Let's see. I've been having pain in my low back area, and it's somewhere. Okay, so the thing is, it radiates down to my lower outer shin. It's my right side, my lower outer shin,
Okay.
and it's not sciatic. I did go see my doctor because I was like, what the heck am I going to do about this? And it's basically in the past couple of weeks, it's just been there. Like if I go for more than 5 minutes walk, it's there, and doesn't go away that easily. But I did have a bone density where it showed that I had some disintegration in my lower lumbar, like, S1, L5,
Sure. Yeah.
4, whatever. And, that's what the doctor said. She thought it was radiating pain from the lumbar area to, down my leg to this
Yeah.
one area. So I'm just wondering if you can help me with any kind of anything that would help with it, I mean, I
So
know.
any pain down the leg, like down the front of the leg, the inner thigh, down the back of the leg,
Nope. It's just basically right on
the shin?
the outside of my shin, about, a third of the way up from my ankle. It's very clear right there.
Okay. And when you're sitting in a chair, do you get like fidgety? Like, is it hard to find a comfortable position?
Not really, no.
Okay, so you can sit for periods of time.
Yeah, I can sit. It's
Okay.
mostly standing and walking, both standing and walking. And I'm sure I'm putting pressure
Yeah.
on that area, but I don't know how to relieve it exactly. I mean, I do a ton
Yeah.
of, physical stuff to try and help with it, which helps for a little bit, but then
Yeah.
I'll stand and walk and it's back again.
Give me just a second. I want to look at the.
Okay.
And you said it's more lateral. It's the lateral part of the
Yeah.
shinbone. Okay.
Yep.
Does it go down into the foot at all?
Sometimes it'll go down into the foot, but
What,
not
what part of your foot does it radiate down to?
just the front of the foot. I mean,
Like the
it's
top,
so
or does it go down into the big toe knuckle?
no. It's like minimal on the foot, so I couldn't even tell you
Okay.
exactly where it is. It's mostly that one area on my shin.
Okay. And no, is it real close to the bone, or is it more to the outside?
It's from the front, whatever that front shin bone is called, and it radiates sort of from the right of the shin bone out to the side, right to the side of my lower leg. Is that
Okay, yeah, like
It could, is there any way to show video so I can show Greg or you can? I'm trying to go off of what you're saying to kind of like show what I think it is, but
if you want to see it, I'm happy to show you.
yeah, let's see it.
Okay. Okay. Let me take my okay, so here.
let me see if I can.
Okay. Okay, so I'm bringing you over here, and the area that it hurts is like from here up through the side. See, this is the front here, and it's like along the side here, about maybe halfway up.
Let's treat it as an anterior tibialis issue, and I'm gonna send
Anterior tibialis.
yeah, which is basically that muscle you're poking on.
Uh-huh. I mean, all I can tell you is that the doctor said that would be the nerve that's radiating out from where it seems to, the lumbar area where it seems to
Yeah,
be starting.
yeah. Let's have you do this. Like, it doesn't look like trigger point. I would say this, like, let's go through some oils that you potentially have.
Okay.
Any chance you have like the trigger point blend or anything like that?
Yes, I
Okay,
do.
perfect. So put some in lotion, rub some on your butt cheek, rub some down the side of your leg, and then rub it down the front of your shin, like in the area. But also put a little bit behind the knee, like in the crease, like but like in lotion.
Uh-huh.
You can put like 3 or 4 drops in just a little tiny bit of lotion, but then like kind of mix it up in your hand and then rub it all in the back of the knee.
Hmm.
And the reason behind the back of the knee is, the trigger point blend is good for opening up lymph nodes, and it does help lymph move, and because trigger points are caused by really stagnant lymph that then cause like some neurological issues.
Hmm.
And be it that I don't think it's a trigger point, but trigger point, that blend does a bunch of other things.
Hmm.
So we want to just kind of unwind the tissue from like the butt cheek down the side of the leg and then down the shin itself, that anterior tibialis. A trigger point for where you are pointing is usually a little bit higher.
Hmm.
And it would have radiating pain down, but usually when it radiates down like that, it would actually go down into the big toe, and you're not really having that issue. And so it doesn't mean, it could still be that way, but let's just kind of shotgun it from like the low back down to the shin and see what happens. And within a few applications, it should start to shift and change. And let's see, so tonight's Tuesday night, like by Thursday night, if it's not even easing up a little bit,
Hmm.
let me know and we'll do something a little different. But that would be the very first thing I would do. Like if you want to rotate it with like marjoram or something like that, but I think it probably needs something a little bit more than just like if you wanted to rotate something else, you could do the pain relief neuropathic.
Yeah, and I actually put that on once because I was like, this must be nerve.
Yeah,
And
it sounds neurological. Yeah.
okay.
But like even with nerve stuff, the more you move the lymph in the area, the more it takes pressure off that nerve and calms that nerve down. And so the other thing you could also try rotating in there would be vetiver, if you have any vetiver.
Yep, I do.
Put some vetiver in some lotion and then rub it in, especially on the shin area. The vetiver is a muscle relaxer, and it does kind of move it moves lymph, but it also increases circulation in the area, and that part can be really prone to getting like really tight and wound up. And so sometimes I'll even go down into the foot, like the arch,
Hmm.
and between the first and second toe, how like there's the bones like here between your hands, like in there.
Yeah.
Sometimes I do that even for things that are an issue with the shin.
Hmm.
Sometimes it helps, sometimes it doesn't. Let's try what we talked about first.
Okay.
See if that helps. And then if that doesn't help, then we'll try some alternatives. But given that you got a little bit of degeneration in the low back, hit the low back, the butt cheek, down the side of the leg, and then the shin, and let's see what happens after a few applications. You can do it up to, you can do it as much as you want, but like probably at least maybe twice a day. And then see how that treats you.
Okay.
Yeah.
Great. Thank you so
Yeah,
much.
you're so welcome. But like if it doesn't work within 24 hours, like let us know. Like,
Okay.
you know, it should, if it's not producing a result like by then, we gotta switch it up a little bit.
Right. Okay.
Yeah.
Thank you.
You're so welcome.
Okay. Bye-bye.
Oh, and another thing, take like maybe 3, 4, even 5 drops of galbanum a couple of times a day.
Okay. I
Yeah,
don't think I have galbanum. I probably do, but it might be in a teeny little bottle.
yeah, just turn upside down and just tap it 5 times and then,
Uh-huh.
you know, put it in water and then just drink it.
Internally. Okay.
Yeah, yeah,
Okay. 3 to 4 drops.
yeah.
Okay. Great. Thank
You're
you.
so welcome. Good talking with you.
Good talk to you.
And then